Our next category, community service, honors individuals and organizations for their leadership in focusing on solving a healthcare issue. So first up, our first winner in the community service category is Mark Lyday, former director of child advocacy and protective services at Children's Hospital of Wisconsin. Mark has spent more than 30 years advocating for new ways to treat and prevent child abuse in our community. He founded the first child advocacy center in Wisconsin and promotes a collaborative model for care. His latest project is a partnership between Children's Hospital and Sojourner Family Peace Center and the development of a brand new collaborative center for the community. And once that's completed, the center will be the largest and most comprehensive family justice center in the entire country. Please welcome Mark Lyday.
So I have to say that I can't remember that I've ever been referred to as a hero before. But I do plan to get a lot of mileage out of that with my family. The people at my table were wondering if there was a cape involved, so I don't know. So I would really like to thank the Milwaukee BizTimes for recognizing me with this Healthcare Heroes Award. As the Director of Child Advocacy and Protection Services for Children's Hospital, I've been lucky to be associated with an extremely talented and dedicated team of doctors, nurses, social workers, police officers, lawyers, and advocates who work every day to meet the needs of abused and neglected children in our state. It's been our goal to develop response systems in communities that are sensitive and effective as well as well integrated. I think this award honors them and their work as much as it does me, and we have a number of our managers from southeastern Wisconsin that are here today with us, and I really would just like to let them know how much I appreciate what they do every day. I have had the privilege to have spent the majority of my professional career working at Children's Hospital of Wisconsin. I can say from my long experience that it is an organization that lives its mission every day. For more than 30 years, they have supported me in my work to improve the community response to child abuse and neglect. I would like to thank the health system, Bob Duncan, my boss, Peggy Troy, our CEO, and the board of directors. It really takes a lot of courage and vision for an organization to consistently expend resources in areas of need like this, where the benefits are not always seen in the short term. It has also really been my privilege to have had the opportunity over many years to work with abused and neglected children. I believe they are the single most disenfranchised people in our society. They have no voice. They are invisible. They are also the most courageous and resilient people I've ever known. It always amazes me, one of the things we do with these kids at our centers is they come to us usually with police or child protection services, and we ask them to tell us about what's happened to them. These are kids that have been beaten. They've been groomed to believe that what's happened has been their fault. They've been threatened. Their families have been threatened. Their pets have been threatened. They have every reason to not talk with us. And so consistently and so eloquently, they tell us their story. While we have had certain successes over the past few decades, much more work needs to be done to ensure that all children in our society grow up in safe and nurturing families. I'm proud of a lot of the things that I've done in my career. The stuff that I'm not proud of, I won't tell you about. I'm particularly proud of the work that we've done in Milwaukee over the last 7 years with Sojourner Family Peace, and Carmen Petrie, the executive director, is here with us today. They are the largest provider in the state for domestic violence services. Together we have developed the Sojourner Family Peace Center. When the center opens, and it's in the process of opening now, for the first time, we'll offer a community-focused integrated model to respond to family violence. All too often, domestic violence and child abuse have been treated as separate and distinct problems, even though we have known for a long time that they commonly occur in the same families. In our new center, which is the first of its kind, we will begin to learn how to help these families in a more integrated and effective way. I'm getting to the end of my career, actually planning on retiring very soon, and it gives me a chance to reflect, And this award gives me the opportunity to thank really the most special person in my life, my wife, Sue. She's been my partner and my friend for almost 38 years. Most of the good ideas came from her. And I will also say that what I've probably learned from her the most is patience and tolerance. Because as most of those people at table 9 will tell you, and most of the people at table 10, I'm not easy. So again, I'd like to thank the Milwaukee BizTimes for this honor. It validates my work and the work of my colleagues. It also helps bring attention to this very needy and vulnerable population. Thank you.